Day continues here on One News Now. I'm Charles Lejano. Provincial hospitals only have until this coming Wednesday, March 24, to use AstraZeneca vaccines. This was announced by the Health Department during its latest briefing held earlier today. To give us more updates on the current situation of the government's pandemic response, we have Greg Gregorio. He is joining us live from Mandaluyong. Greg, good afternoon. Why exactly did the DOH set this deadline for the use of AstraZeneca in the provinces?
Charles, the Department of Health highlighted that this intervention intends to reach wider scope of individuals to be given the first dose of COVID-19 vaccine. As of the latest report, 1,623 vaccination sites are already doing COVID-19 vaccinations in various sites in 17 regions in the country, and more than 336,000 individuals have been given the first dose. Under Health Undersecretary Maria Rosario Vergere, meanwhile, clarified that even though those vaccine supply will be reallocated to another hospitals, they give assurance to these hospitals that everyone will still be given the necessary supply of COVID-19 vaccine, since the World Health Organization has already committed that more than 900,000 doses of AstraZeneca shots from the COVAX facility will arrive in the Philippines soon. Charles?
Right, Greg, are there any plans to hire more health workers in provincial hospitals, and will they be given the choice to get vaccinated as well?
Charles, according to Vergere, every health worker will be given a chance to be vaccinated. And now they are studying on how to augment the needed or the necessary health workforce needed for the COVID-19 response across the country, as we are seeing the increase of COVID-19 cases, recording more than 7,000 new cases daily in the past 3 days. Charles?
Right, we are currently in a new quarantine classification, Greg, but then it's not exactly new. It is a little different from what we had before. What is the government saying to critics saying that we are failing in terms of pandemic response?
Yes, Charles, for the Department of Health, they say that it is quite unfair for the critics to tell that the government is failing in response or in addressing this COVID-19 pandemic. Health Undersecretary Maria Rosario emphasized that they are doing everything what they can. The local government units and the agencies are now at heightened alert. The LG is augmenting the contact tracing efforts of the local government units. Testing capacity is at around 40,000 average. And they are also making sure that hospital occupancy will not be overwhelmed in order to address the increasing COVID-19 cases in the country. Charles?
All right, Greg, over the past 12 months, we've been talking about different remedies or cures or prospective medicines for use with COVID-19. There's remdesivir, there's even hydrochloroquine, according to some people who have suggested this. But do we have any updates on the use of this new drug, Ivermectin? What is this all about?
Charles, Ivermectin, according to the Department of Health, has not shown any positive result yet in terms of addressing COVID-19 in clinical trials conducted abroad. Thus, the Department of Health is appealing to all medical health workers, recommending the use of Ivermectin in order to treat COVID-19 patients. According to Vergere, the Food and Drug Administration has also recently issued an advisory against the use of this drug, as the Ivermectin supplies here in the Philippines are mostly for veterinary use. Thus, it may give negative results to individuals if it will be given to them. Department of Health said health officials, health authorities, including doctors, must always side with the science and evidence before recommending any drug, especially amid this pandemic. Charles?
All right, so no go for Ivermectin, but then what is the DOH's stance on the private sector's vaccine procurement?
Charles Vergere clarified that they are not blocking the intent of private institutions to procure for their own supply of COVID-19 vaccines. However, Vergere emphasized that these procurements must be coursed through the national government under a tripartite deal. And Vergere even mentioned that at the end of the day, everyone will still be given a COVID-19 vaccine, regardless if it is procured by the government or the private institutions that they are under. Charles?
All right, we've been doing over 7,000 new cases daily. Greg, what is the situation with public and private hospitals in the country? Are these nearing full capacity?
Charles, according to Vergere, the isolation wards and COVID beds in most hospitals are still at moderate risk, but that they are closely looking into or monitoring those ICU beds in hospitals, especially that there are already private hospitals saying that they are at a critical level. When we talked to the president of the Private Hospital Association of the Philippines early this morning, Dr. Jose De Grano, president of the PHAP, said 30 private hospitals in the National Capital Region are already at a critical level, while most of their 500 members are already at a high risk. They say, though it is still manageable, they would need more workforce in order for them to follow the requirement of the Department of Health or the government to further expand their allocation for COVID care. Charles?
All right, Holy Week is coming up, Greg. How is the government planning to slow down transmission during the upcoming observance of Holy Week?
Charles, officials have been saying that officials have been encouraging the public to, instead of going outdoors, celebrating or commemorating the Holy Week, they are encouraging everyone to just stay at home, and if there are nothing essential to do outside, just stay at home, and so to decrease the possibility of transmission of the SARS-CoV-2. Charles?
All right, do we have any other salient points discussed by the DOH during the latest briefing?
Charles, according to the Department of Health, they are indeed seeing an increase in the number of consultations and are related to the mental health, especially with the National Center for Mental Health. According to the latest status, as of March 15, 2021, over 3,006 Filipinos were provided mental health service just within the year since January to March 15. And most of the cases are about anxiety and depression, stressful life event, interpersonal concerns, mood concerns, and referral services. According to the Department of Health, they are closely looking into it, especially that we are under the pandemic. Charles?
Thanks for that, Greg Gregorio, reporting live from Mandaluyong. We have some breaking news as of 11 a.m. today. The COVID-19 ward and ICU units of St. Luke's Medical Center, both in Quezon City and BGC, have reached full capacity. However, the hospital remains in full service for non-COVID cases, both inpatient and outpatient. Stay tuned here on One News for the latest on this development. Health workers have expressed concern over the higher mobility in the upcoming Holy Week. HPAC's Dr. Maricar Limpin says they're worried about the anticipated Holy Week activities, especially interprovincial ones. Limpin fears that people traveling to their provinces or to tourist destinations may possibly get infected there, and that these infections may not be detected once they return to Metro Manila. This is why HPAC is calling on LGUs, even those outside NCR, to implement uniform travel restrictions and requirements. Limpin also calls on local chief executives to coordinate with each other to prevent a further increase in COVID-19 cases due to the Holy Week.
Sometimes they get it from the province, and then when they come back to Manila, they already are positive. So the more that we will be burdened with higher increase of COVID cases in Metro Manila. Alam naman natin that the biggest burden of COVID-19 is here in NCR.
tourists have started to cancel their Holy Week reservations in some resorts in Laguna due to stricter travel restrictions. Aside from prospective losses, resort operators are also lamenting unclear guidelines. To give us details, we have with us Romel Lopez reporting live from Laguna. Romel, good afternoon. What's the latest?
Yes, Charles, good afternoon. Resorts operators here in Laguna who are looking forward for the Holy Week now have their backs against the wall yet again as booking cancellation starts pouring in. This on the back of the IATF announcing stricter travel protocols amid the rising cases of COVID-19 in the country. Resorts operators are now draining their pools here in Barangay Pansol in Calamba, Laguna. One of them is June Makidatu, who said all Holy Week reservations at the resort have been cancelled as the IATF resolution only allows essential travels. Resort operators can't help but feel disappointed as they were hoping to make up for their last year's losses. But that's not the only problem they have here. Makidatu said that the resolution also caused some confusion as they even don't know if they are included in the businesses that are allowed to operate until April 4. According to Jeffrey Rodriguez, the head of Calamba's Public Order and Safety Office, the new IATF resolution states that open-air attractions such as private resorts are exempted. Rodrigo said the operation of such resorts in Pansol will continue but only at a limited capacity. Only 20 guests are allowed per private resort. Based on their interpretation, resorts in Calamba can also accept guests even outside the GCQ bubble. Calamba Public Order and Safety Office also noted that children are allowed in these resorts provided that they will travel with their families in a point-to-point basis. This means that they will road a private vehicle from their houses and headed straight to the resort to avoid COVID-19 transmissions. Guests will no longer be allowed to leave the resort throughout the duration of their stay. Charles Rodriguez clarified that this is just their interpretation of the new guidelines as he admits that some rules under the new resolutions remains vague. He said that resorts here in Laguna are ready to cease operation if this will be mandated by the IATF. Charles?
Thank you, Romel Lopez, reporting live from Laguna. And those are the top stories of the hour. Join Sean Yao later at 2 p.m. as we continue to monitor the day's biggest stories. You can also catch One News on Signal Play. Just register for a free account at www.signalplay.com so you can stream One News live anytime, anywhere. I'm Charles Lejano. Mask on, wash hands, and stay safe, Philippines. We are One News.